Hi, I'm Wojtek Wierczuk. I am a faculty member here at the Department of Health Research Methods, Evidence and Impact at McMaster University. And I work with the research group at the McMaster Grade Center, for which I'm the director, and the Michael G. DeGroot Cochrane Canada Center. When a healthcare provider like your doctor advises you on what to do for your health, like suggesting a specific treatment, a test, or a preventive measure, this recommendation is usually based on a health guideline. But what is the difference between a recommendation and a guideline? Let's explain. In terms of health, a recommendation is intended to be a clear statement that helps healthcare professionals, patients, as well as policymakers to make informed decisions about the available actions and options they can take for treating, diagnosing, or preventing a particular health condition. Guideline groups developing recommendations also assign a strength to them. A recommendation can be a strong recommendation, which means that most individuals would want the recommended course of action and only a small proportion would not. A recommendation can also be a conditional recommendation, which means that while the majority of individuals would still want the suggested course of action, many would not, and an alternate course of action or option may be the best for them, considering their individual risks, values they place on the possible health outcomes, and their individual circumstances. Health guidelines, which are also referred to as clinical practice guidelines or simply as guidelines, are a collection of recommendations for a specific health condition. Health guidelines have typically been written for healthcare professionals as the main target audience, but patient versions of health guidelines or guidelines for policymakers are also commonly developed. The development of guidelines and the recommendations they contain should be supported by evidence from the latest research, considering the benefits and harms of different treatment, diagnostic, or management options, and how certain we are about these benefits and harms from the research evidence, as well as additional factors such as patients' values, the costs of using the options, feasibility of using the options, or the impact on health equity. Let's take a recent example of a guideline we worked on. The American Society of Hematology, working with our McMaster Grade Center and a panel of experts from the US, Canada, and internationally, developed a guideline for management of venous thromboembolism or blood clots in pregnancy. This guideline contained 31 recommendations related to the treatment, diagnosis, and prevention of blood clots in pregnancy. An example of one recommendation from this guideline is in pregnant women with low-risk acute VTE or a low-risk blood clot, the panel suggests initial outpatient therapy over hospital admission. This means that if a doctor treating a pregnant person who develops a blood clot that is considered low risk according to their assessment, they may prescribe a blood thinning medication, or what is called an anticoagulant, to be taken at home to treat the clot. Note, however, that the strength of the recommendation here is conditional. This means that the alternate course of action, which is being admitted to the hospital for treatment, may be the preferred choice depending on shared decision-making between the doctor and their patient, considering their individual values and circumstance. To learn how guidelines and recommendations are developed, view our video titled "A Guide to Trustworthy Guidelines. What are they and why do we need them?"